and welcome. My name is Cassie. I'm a registered nurse here at the Phoenix VA in the Hematology Oncology Department. We'd like you to know that our staff is dedicated to the success of your care. We understand that the diagnosis of cancer can be stressful, so we strive to make sure that your experience is as seamless as possible. We work with a multidisciplinary team to ensure that you get the care that you need and deserve. Your cancer care will be unique to you. You may be required to get chemotherapy, immunotherapy, radiation, or a combination of these. If you are required to get chemotherapy or immunotherapy, this will be done in our outpatient infusion clinic. We have specially trained, experienced nurses that will be providing your care. Your safety and care are important to us, so you will be required to have lab work done prior to every treatment that you get. We also want to remind you that multiple visitors and children under the age of 18 are discouraged from coming into the infusion clinic for safety reasons. We encourage you during your treatment and during your journey to call our clinic at any time with any questions or concerns you may have, because we want to be here with you every step of the way.
Hello, my name is Brenda Griffin Collins. I'm a board certified chaplain and part of the chaplain service department, as well as part of the cancer oncology team here at the VA hospital. When you come in and get a new diagnosis, it can often be a challenge to your spiritual life, because nobody expects for something negative to happen in their lives. But a cancer diagnosis isn't necessarily a death diagnosis, and sometimes you just need to talk about it. So part of my role is to be a good listener and to help you get in touch with your faith and how that affects the whole process that you will go through in the cancer department. So whether you need a prayer, a listening ear, you need us to contact your personal spiritual leader, whatever you need to be of support to you and to get you through this journey, we're here to help. Looking forward to seeing you when you come through. Take care, be blessed.
Hi, my name is Lisa Terry. I'm the oncology social worker. My role is to help reduce cancer-related distress regarding emotional concerns, financial concerns, or practical concerns. I can also help you with advanced directives, which is like a living will and healthcare power of attorney, and I can help link you to community resources that might be helpful to you. In terms of emotional support, we offer a wide variety of options to assist you in coping with a cancer diagnosis. We have cancer support groups, and we also offer individual counseling. For practical concerns, we offer assistance with things like transportation, lodging during cancer treatment if you live far from the VA, and services that can help you at home, as well as services in the community if it's no longer feasible for you to continue living at home. For financial support, I can assist you with information on VA benefits, Social Security, Arizona long-term care services, and emergency financial resources to help you with things like rent, mortgage, or utilities if you're having a hard time. I look forward to meeting you in person and working with you. Thank you.
Hi, my name is Melanie Doyle, and I'm one of the physical therapists here at the VA hospital. I'm going to be talking to you a little bit about the role that rehab or rehabilitation will play during your cancer treatment. Chemotherapy, surgery, and radiation obviously can take a toll on the body. Our goal in therapy is to empower patients to take an active role in their care so that they can attain the best quality of life during and after your treatment. It can be helpful to make rehab a part of your process in your cancer treatment. Some signs you may need to show that you may need rehab services are wondering how to prevent things like lymphedema, which is swelling of an arm or a leg, experiencing joint aches and pains, feeling more tired, which is cancer-related fatigue, unsure about how much or how best you should exercise, physical difficulties related to neuropathy, which is numbness of your arms or legs, difficulty with your balance, difficulty walking, performing daily tasks, and difficulty with things like range of motion after your cancer treatment is complete. How can physical and occupational therapy help? We work to address things like pain. We use non-drug-based treatments such as soft tissue and joint mobilization, electrical stimulation, heat, cold. We work to alleviate musculoskeletal dysfunction, improve posture, help to maintain muscle strength, flexibility, and restore muscle balance. We work to improve your endurance. We work with your family to educate them on the process of rehab. We work on things like scar tissue management, as well as gait training, and we assess for different devices that could assist with ambulation and your activities of daily living. It is important to maximize your mobility on the days that you feel well. Do what you can on your difficult days. This is going to help decrease muscle and bone loss. It's never too late to utilize our rehab services for your recovery. Feel free to reach out to your doctor to get a consult to physical or occupational therapy along the way. Next up, we're going to be talking a little bit about nutrition during your cancer treatment.
Hi, my name is Liz, and I'm one of the dietitians that works in the oncology clinic here at the VA. And today I just want to tell you a little bit about the role of the dietitian. First of all, our role is to assess your nutrition status. We're also going to help you come up with goals to help you maintain your nutrition status during your treatment. We're going to help you manage any kind of side effects that might come up with your treatment, and those could look like poor appetite, some gastrointestinal issues, or even fatigue. We also are here to answer any questions that you might have about complementary or alternative medicine. Lots of people come to us with those questions, and we're happy to help you with that. The most important thing I want you to know is that everybody's cancer is a little bit different, and because of that, there is no magical cancer diet. What is most important to us is that whatever weight you come in and start your treatment at, we're going to want to help you stay right about at that weight throughout your whole treatment. And that means we'll sit with you, we'll talk with you about foods that feel good in your body, that taste good to you, foods that you are capable of making and you know how to find at the grocery store and keep safe at your house. So the dietitian will probably see you in the first treatment, and we'll introduce ourselves, and then we'll check in with you throughout your treatment.
All of your chemotherapy preparations must be 3 things. They need to be sterile, which is germ-free, need to be accurate, so it has to be the right medication and the right dose that's getting made for you, and it needs to be timely. The pharmacists and the pharmacy technicians work efficiently and effectively to make sure that happens for you. Once you get your labs and the labs result and your nurses evaluate you and say, this patient is going to be getting treated today, they call up to the inpatient pharmacy and let them know to go ahead and make your chemotherapy. We can't compound any of our medications before you come in because we do need to make sure you're ready and good for treatment. Specially trained pharmacists and pharmacy technicians then make the medications in our inpatient pharmacy, and it gets brought down to the clinic. It's important to note that it can take between 20 and 40 minutes sometimes to make 1 chemotherapy dose, depending on what the medication is and how it gets prepared. Just know that your pharmacists and your pharmacy technicians are working quickly and efficiently to make sure you have the safest delivery of your medications possible.
Hi, my name is Mindy Skelton, a nurse practitioner from the Outpatient Palliative Care at the Veteran Administration Medical Center in Phoenix. Today I wanted to spend a little bit of time to talk to you about our palliative care medicine and what it can offer you during your journey. Our palliative care team involves physicians as well as advanced practitioners and medical psychologists and chaplain services and social services, as well as our clinical pharmacist resources. Palliative care is a program that is available for all veterans that are suffering with serious or even complex chronic illness. Some of the chronic illness that I'm talking about is congestive heart failure, chronic lung disease, and end-stage liver disease and renal disease and dementia. And as we are talking about more of an acute, serious illness for this setting is cancer. Palliative care provides a continuum of a comfort and social services in the areas of inpatient hospital stay, as well as outpatient clinic setting, and even in the home settings. Palliative care can be provided concurrently with other medical care used to actively treat or cure an illness or even prolong life. And we touch on the areas of our physical burden as well as emotional and spiritual and psychosocial, some of the burdens that are experienced by our veterans and family members. It has shown that optimizing the management of these burdens and symptoms has significantly impacted one's quality of life and their physical and functional status, and even prolong life. We also address goals of care. And what I mean by that is to share with us your preferences as far as what you hope to accomplish through this endeavor. So we talk about the extensiveness of your conditions and the treatments that you've engaged, and also how that will look like as far as your life thereafter. We addressed your advanced directives that you've completed, and if it hasn't been, then the oncology social worker will be able to assist with that. And we also delve into some conversation that is so crucial, but it is often hard to address, to talk about your life-sustaining treatment decisions and goals. The questions that we would address with you is, number one, what is your understanding of your illness at present? And if your health status should worsen, what are the most important goals that you have in mind? And what is your biggest fears and worries about the future of your health? And what is it that's some things that are so critical that you couldn't live without? And if you got sicker, how much more would you go through to gain more time? These are the questions that will stir up lots of uncertainties, but it gives some directions as far as how you would like to have this journey look like or pan out. And we want to be along that side right with you. Now, for some veterans, it may not be necessary, but for some, it would be, and it's care coordination. Some of our veterans receive care outside of the VA, so some of the challenges of getting care coordination is pretty tough. So we have actually provided some services to help fill the gap so that you'll be able to continue treatments without having to experience such a burden. And I just want to also say that this is a brief video of information of our palliative care medicine and services that we provide. So when we do meet face-to-face and your initial meeting with the oncology team, we would like to also entertain some questions at that point. So while you are looking and listening to this video, think of some of the questions or concerns that comes to your mind, and we hope to share that with you when we do meet. We are able to meet with you in various ways, and you can reach out to us in a Go Clinic, or you can reach out to us via the My Secure Messaging through My Health event. And if you would like, you can even come to the Go Clinic and have an opportunity to meet with us face to face. Thank you so much for allowing us to join in your journey. It is such a privilege to come alongside you and to be able to help you and support you through this endeavors. Thank you.